Go ahead. When you share screen,
A very good morning, ladies and gentlemen. Welcome to this webinar on safe tourism. I think that it is very timely that we have this webinar. As you know that we have a new addition to COVID that is Omicron, which is now there. And this morning, the Honorable Minister of Health of Malaysia also tweeted saying that this is more dangerous than Delta, and we should look into safe distancing, hygiene, and also the airflow, indoor airflow, and be vaccinated. Even yesterday, Channel News Asia in Singapore announced that a flight from Sydney to Singapore via Singapore Airlines, there were 2 passengers positive of this new variant. So today, with iPortal and DHS, this webinar, we have speakers from the United States, we have from Indonesia, from Philippines, and also the Republic of China, and not forgetting our speakers from Malaysia. And our honorable speaker today is Professor Dr. Ansari, the President and Group CEO of Asia E University. So, Dato, we hand over the floor to you for your welcome speech.
Thank you very much, Dr. Sri. Assalamu alaikum warahmatullahi wabarakatuh. A very good morning and a very good evening, and greetings to all of you wherever you are. We are gathered this morning and this evening to discuss a very important topic on safe tourism. And we all know how COVID-19 has upended the global travel and brought the world to a standstill effectively. For the first time in history, close to 90% of the world's population lived with travel restrictions. Airlines, travel companies, and the tourism sector as a whole among the most affected businesses. That's across the board. From hand sanitizers in hotel lobbies to cabin crew in masks, localized lockdowns to contact tracing apps, COVID-19 has transformed the world of travel. Amid closed borders and canceled flights, travel came to a virtual standstill practically everywhere. Today, as much of Asia begins to emerge from the lockdown, an industry that accounts for about 10% of the world GDP is looking towards the new normal. Some people no more call it the new normal, but they say there's never normal. And I think the Omicron is going to prove that it's never normal. As travelers, many of whom have been largely confined to their homes for months, we are all hoping and dreaming that again we can hit the beaches, mountains, and look at monuments and museums and visit museums. Yet reopening travel presents its own challenges. And as new variants of concern arise, you'll find this more and more of a challenge. Make no doubt about it, we will travel again. But when will it be, and will it be the same form of travel? That is a question that we need to answer ourselves. And at the moment, it's a wild guess. When borders reopen, travelers must trust that boarding a plane is safe and they will be able to enter the destination of country safely and travel and visit the country safely. New health safety protocols and systems will need to be placed in place to give us all as travelers the comfort in traveling. Many Asian travelers maintain a genuine fear of infection. Here in Asia, many families live with their parents or their grandparents who are more at risk. So younger travelers are not necessarily concerned for themselves, but their concern is actually going home and bringing the disease home and infecting their parents or grandparents who are much more vulnerable. And this fear is shaping how travelers approach journeys. First, people are very cautious about health guidelines. So we work closely with our partners to ensure hotels and airlines must be safe partners. Second, people prefer to travel within smaller groups, for example, with only family members or with very close friends. Third, we have seen certain demand used to be for outbound travel, now is mainly turning to domestic travel. And this is because of travel restrictions and other what they call considerations. As governments and industry plan for recovery in this new normal, or next normal. The context and adapt to changing traveler behavior, the use of digital identity and biometrics technology could restore some trust while also ensuring a seamless journey. The most immediate and perhaps most visible change will be a shift to touchless travel from airport curbside to hotel check-in. Even with strict cleaning protocols in place, exchanging travel documents, touching surfaces to check in, security, border control, boarding, sitting in what we call aircrafts still represent a significant risk of infection for both travelers and staff involved. Automation across the entire sector will become the new norm. Biometrics is already a widely accepted solution for identity verification, and their use will become more widespread as physical fingerprint and hand scanners are phased out. It is believed that technology for touchless data entry, such as gesture control, touchless document scanning, voice commands, will be tested now for the travel industry as well. Care must be taken to ensure these technologies are inclusive and not to eliminate the risk of potential biasness and cut out genuine travelers. From now on, health could be embedded in every aspect of travel. According to a survey by the International Air Transport Association, IATA, measures such as visible sanitizing, screening, and masks all increase passengers' feelings of safety when thinking about traveling. With the passengers' consent, travel companies and airlines perhaps could use personal data such as their age, underlying health conditions, and travel history to compile an individual risk profile and therefore provide better service for such travelers. Most important, I believe, that moving forward, we have to do more homework. We have been in the past doing our homework before traveling, but I think now we have to do much more careful research for the destinations that we are planning to visit regularly, leading up to our scheduled trip itself, as different states and countries and cities have different regulations and will be at varying stages of opening and requirements. We have to also consider when traveling internationally, whether the destinations have got required and mandatory COVID-19 testing, either before departure or upon arrival, and that's for our own safety. We need to think, who are we going to spend time with, and communicate how you would like to prepare for the trip on the other side of the travel tour, what they call agencies, etc., and all that kind of thing. We will also be traveling by air, most likely. So we have to review airline policies closely, as they're all doing different things when it comes to safety. Some flights will be emptier than others. So a good bet would be to choose flights later at night or red eyes for the least crowded planes so that we are much more safer when we travel. Most important too, many are moving towards taking greater travel insurance in order to protect themselves from any possibilities of any illness as they travel, or any cancellations due to the pandemic. This webinar with so many distinguished speakers will be very interesting. As experts, you will be sharing your experience, expertise, and how to engage in safe tourism moving forward. I believe that people's demand and desire for travel is still very strong. We have all been locked down for a long, long time, and it's human nature that we want to explore and enjoy our lives outside our homes. So with that, I would like to thank again the moderator and the organizer, Dr. C. Kumar, as well as iPortal, my good friend Siddiqui. Thanks for this welcome, for me to get the opportunity to talk to you all, and to start off this, what you call this webinar. I wish you all the very best in the discussions moving forward, and I'll be listening from time to time the discussions so that I'm sure there are lessons for all of us to learn as we are travelers ourselves, or we are involved in some way in the travel industry one way or another. Thank you very much, and I wish you all the very best in this webinar.
Thank you, Professor. Thank you very much for the points brought forward. Very interesting, and you can be rest assured that we have speakers from the airline who are here today to share on how they prepare the aircrafts before it takes off, and also the other speakers. Okay, today I would like to call upon Dr. Roshdi from New York, the founder and CEO of iPortal. Dr. Roshdi, over to you.
All right.
Assalamu alaikum, and a very good morning to friends, colleagues, esteemed guests from Asia and globally who have taken the decision to be with us. This is an important topic, safe tourism, but I want to look at it from beyond COVID-19 protocols. I want to talk about it from a point of a data. What I'll show you today is something that is pioneering work that we're working on that even my colleagues at iPortal have not seen. So with your permission, let me show you two things. The first thing that I will show you a few slides from my presentation. Okay, and then I will take you to the site. Okay, here we go. Okay. So big data and travel and tourism, where we are today is 1.0, where the source of the data is often by way of surveys, voluntary information. The data is often snapshot and it's aggregated, often commoditized, and there's noise to it, which is fine. We have to start from somewhere. So we are basically data 1.0 in travel and tourism. This is basically where Friendster and MySpace was in the early 2000s, an aggregated approach, and Facebook disrupted that with an interactive approach. So today, what I'll do is show you a sampling of the interactive approach in this particular space, where we're going to look at interactive data, giving us insightful and suggestive, which will help on government policy, which will help on destinations because they operate in a dynamic environment. The source will be social media network and media. And the key issue here in 2.0 is noise reduction, reducing and filtering out misinformation. What we hope to do today is set the foundation for data and travel and tourism in 3.0, where you're going to see an exponential growth of data and has to be analyzed. There's fragmentation of data, velocity of data. Data has four elements to it, what we call the four V's. The first one is volume. The scale of data is immense. We're talking about zettabytes and terabytes. It's a one with many, many zeros. So that's the first thing. The second aspect is the variety of data. It comes from a variety of sources. Therefore, there's an element of fragmentation. The veracity of data, which is the third V, goes to the uncertainty of data. This is basically to do with removing and filtering noise, which can create biases. And the last thing, which is labeled here, is the velocity of data. What that means is the speed of which data is generated, distributed, collected, and then the process of analytics and algorithms with the end result of being able to make informed decisions in almost real time. And obviously the last aspect of data 3.0 is regulatory complexity. So this sets up the foundation of what I want to talk about. This is how present coverage at a country level for tourism is covered. This is basically from the UN World Travel Organization. You go to their country page, and then this is their country page on Malaysia. It talks about the usual suspects, the commoditized information that I talked about. And I won't go into this because we are all aware of these metrics. I wanted to show what Crescent Ratings is doing with respect to data. So they've got the Global Muslim Travel Index, and this is 2021. And here's Malaysia. It's the #1 GMT destination. And well, I want you to focus in on communication. Communication becomes an extremely important part of the outreach. And I'll tie that in because there's an outreach, then there's an engagement, and that engagement has to be measured by sentiment, and that's where data comes in. So that's what is happening in this space. The last thing I want to talk about is the safe tourism. Safe tourism, not only in general concept, but we've identified about 66 types of tourism. On this particular page are 37 types of tourisms. This is an expanding area, and each of these has an element of safety associated with it. What I want to show you now is basically a sampling of what real-time data looks like now in this space. Okay. if you just bear with me, please. Here, okay, here it is. Okay, thank you. This is basically a tourism chart, right? And this is a bit different than what I showed you with respect to snapshot data. So if we were to look at Malaysia, and we look at data that we've accumulated from January to November, and if we look at certain touch points, right? And we start off with, say, a data point here. This is basically what is happening in this point in time with respect to tourism in Malaysia. And if we basically filter out more details, this is what's happening in Malaysia at this particular point in time, okay? So what we've done here, if you think about it, is created a time series candlestick approach to tourism based on social media sentiments. The capture of those sentiments, which is that engagement, and then showcasing it. So policymakers and decision makers have an opportunity to see what is the chatter about in real time, as opposed to getting snapshot information at an aggregated point. So if I were to show you another touch point, here in February was a low point, then here we saw the government of Malaysia do more things. And as a result of this, we've seen promotions from the government of Malaysia, and these were some of the things that were happening. You can see basically the engagement, the positiveness, at least on that particular day, and we can see who the government has partnered up with. So this is an extremely interactive approach of how tourism, at least by the government of Malaysia, as captured by sentiment over time series, looks at. Here, we've got basically a valley. Here, what you've seen is basically where COVID impact numbers shot up. So the area of tourism basically got hit hard, and it basically showed by way of social media chatter here and here. And I'm just showing you the level of information that one needs to basically process to get to an output. And the last data point is November, as we ending up 2021 and move towards 2022. What is the government doing? And we see a spike slowly happening with respect to sentiment in Malaysia about this. And you're seeing these type of things that are happening by way of what is going on. So for example, what the tourism ministry is saying. So here, what we've done now is basically showcased tourism at a country level in real time using social media, applying artificial intelligence to social media, removing biases and misinformation, and showcasing it by way of a candlestick over time series. So now we've got a sort of a profile in real time about what's happening. As we move forward, we'll get more into this thing. Now imagine having 193 countries having this type of display for their dashboard to make informed decisions. So I'll stop right here. I want to thank Dr. Sri and others allowing me time to share what I think is going to be the data 3.0 approach to this particular space. So thank you. Assalamu alaikum.
Thank you, Dr. Rosti. Thank you for the very informative information on the data on tourism. It is always very interesting to hear your presentation. Thank you very much. Now we would like to call upon Mr. Zaidin Siddiqui. He is a second-year student majoring in data science at the University of Utah, USA. Very interesting gentleman. I got to see his presentation twice on COVID-19. Zaidin, over to you.
Well, good morning. It's a pleasure to present alongside a group of accomplished colleagues. Let me just allow the screen, share the screen. Okay, Well, this page, COVID-19 travel, is chiefly intended to shed light on the question, how has COVID-19 crisis affected international and domestic travel while illuminating current and future case projections in ASEAN countries? On the header of the page on the top, you'll see stocks, vaccine and therapeutic stocks from Pfizer, BioNTech to Regeneron Pharmaceuticals. I've inserted the stickers since these entities and their partners developed the vaccine against SARS-CoV-2. Vaccine stocks rebounded on Monday amid a virus variant fears of SARS-CoV-2 variant regarded as Omicron. The page contains up-to-date information concerning travel restrictions by countries following the Omicron variant outbreak. Now we will take a look at some health restrictions. So we'll look at Singapore. So here at Singapore, as the COVID-19 situation around the world changes, iPort will be monitoring the travel restrictions and making recommendations. So here, says here, this data is aggregated from the United States Centers for Disease Control and Prevention. It shows whether testing is recommended, required, whether masks are required or not. So there's 4 levels: very high, level 3, moderate, designated by the World Health Organization. Below this data table is a map where I used aggregated data from this United States Centers for Disease Control Prevention and trip.com to showcase the destinations. For example, we will take a look at Singapore. If you want to know the restrictions, for example, Singapore to Malaysia, if you're traveling, we will zoom in and we will see here, Singapore to Malaysia. So you'll click on the icon, it shows the source airport is Singapore and the travel airport will be in Malaysia. So this will show an overview. So it says from November 29, 2021, the visitor will need a vaccinated travel lane in order to enter that region. So I will go back to the landing page now. Above our country profiles of members of ASEAN, plus the 8 most affected regions, this page contains crucial travel restrictions, vaccine eligibility groups, and more. So we'll take a look at Malaysia now. So on the top is an overview highlighting confirmed cases, deaths, doses administered. Below is a map. And here we have key information for Malaysia. So we have, again, this is tribal health notices. Below that are what vaccines are available in Malaysia: BioNTech, Moderna, AstraZeneca. And here is data taken from the World Health Organization showcasing deaths, cases, trends through an animated time series. Below are trends, cases, and deaths. The user can filter the data. I'll go back to the landing page now. So to the right is COVID-19 news displayed through an RSS feed from Google News. Below are COVID-19 mobility trends and additional COVID-19 related data. The first box is a forecast of COVID-19 cases, deaths, and hospitalizations. So here is the projection. So the projection date goes to March 1st, 2022. We will look at another member country of ASEAN. We'll look at Indonesia. So the first filter on the right is the daily infection rate. So here you'll see highlights all the way over, and there's a drop-down menu showcasing, again, daily infections, daily deaths, vaccination rates projected for March 1st, 2022. In addition, we have global totals. So to tackle the coronavirus pandemic, countries across the world have implemented a range of stringency policies, including stay-at-home orders, school and workplace closures, cancellation of public events and public gatherings, exercise through mobility trends. So here is data taken from Oxford and Our World in Data, showcasing 4 trends: resident category, parks and recreation, travel, and day-to-day changes. So you hit the play button and it shows a time series. If you want to get a map, you hit a time series again, and you hover over the region, over a region, and you click on the region and it shows it. So this data set from Google measures visitor numbers to specific categories of location, as mentioned, grocery stores, parks, train stations, every day, and compares this change relative to the baseline before the pandemic outbreak. So that's my presentation. So thank you.
Ms. Dr. Sri. Okay. Zidane, very well done. Dr. Sri may be encountering some technical difficulties right now, but thank you very much for that very informative, data-driven presentation focusing in on safe tourism going forward, focusing on ASEAN countries and the different aspects, say, within Malaysia. So really well done. Thank you, Zidane. Our next keynote speaker is the managing director. His name is Mr. Kanasen Supaya. I apologize if I've mispronounced your name. Please excuse me and forgive me. The podium is yours, sir.
Thank you very much. A warm welcome to all the honorary speakers, the panelists, and all those who are participating in this safe tourism, I would call it a seminar. My name is Kanasen Supaya. It was pronounced properly, Kanasen Supaya, and I come from the aviation industry. I have 50 years of experience, about 35 in engineering, maintenance of aircraft, a lot of support services, and then I moved on to catering, where the hygiene standards are extremely high. And basically what we are saying is, it is safe to fly, and the captains and the cabin crew and all the cockpit crew are all back in the cockpit flying. They are no more flying the aircraft from home. They are not working from home. Ladies and gentlemen, a little bit of technical information for you to start off with. That is the airworthiness and safety standards that are very highly regulated and monitored in the aviation industry. Why this is so? It is because a simple error and oversight, negligence, any of these could cause catastrophic results. Okay, and therefore the regulators, they are very, very serious about the job that they do to ensure that aircraft flies safe. So that is the regulatory bodies, and we have in the US, the FAA, in Europe, with this EASA, and locally we have the CAAM. And all these are regulatory bodies, and their main job is to ensure that everything is enforced, all right? And so as not to allow any errors to come into place. Now this is actually indoctrinated. The safety of aircraft is indoctrinated to all levels of staff. So much so, those service providers in the industry for the airlines are also extended the same standards so that everyone makes sure that aircraft flying is safe. And you can be rest assured at the moment with COVID moving aside, aircraft has started flying, and let's go into the other aspects of aviation industry and what airlines do to keep aircraft passengers safe so that they board the aircraft and land safe in their destinations. Now, the seriousness of airworthiness and safety is indoctrinated, as I said, all right? And the safety designs that are already available in the aircraft, just to let you know, this is basically for the passenger comfort, the air conditioning, the pressurization of the aircraft, and the other areas of disinfection and cleaning at every point of landing is taken into consideration. Now, why is air conditioning so important? Basically, air is drawn in by the jet engines, ducted through the main ducting into the cabin, and air, the cool air, which is about 23 to 25 degrees for passenger comfort, is blown from the ceiling panels into the cabin. Now, the smaller ducts are there for each individual passenger to control and keep himself comfortable. Now, these air conditioners, they are sophisticated and they convert the air into cool air into the cabin. Now, as the cabin gets cool air from the ceiling panels, from the PSUs, passenger service units, it comes down to the passengers, and it is actually the circulation is limited within a few rows. And this is to make sure that anybody who comes into the aircraft, who is flying the aircraft as a passenger, does not contaminate the other passengers who are on board. It is safe to say a person with the flu comes into the aircraft and he does not contaminate the whole aircraft with that flu. Why? It is because of the air circulation, which is limited to a few rows of seats. At the same time, whilst the aircraft is being cooled and kept cool for passenger comfort, there are extractors that run along the lower part of the cabin to make sure that the air, the used air, is at the same time extracted from the cabin, and therefore the cabin remains safe for practically all the passengers who are on board, and the safe is also extended to the cockpit. Now, for passenger safety and for passenger comfort, which is very important, can you imagine 400 passengers flying in the aircraft? All right, how do they keep them comfortable? The aircraft design itself brings about pressurization. Pressurization, basically, if you look at the air, as you go higher and higher and higher, the air becomes thin and it will be becoming very difficult for you to breathe in. So the cabin pressurization is kept to about the 5,000 to 6,000 feet level above sea, so as to make it all the time comfortable. Although the aircraft is flying at high altitudes, for the international flights, it's about 30,000 feet, and for the domestic flights, it's about 15,000 feet. So whilst we are flying, the cabin condition is kept as if you're in 5,000 to 6,000 feet above sea level. So I have covered what air conditioning is all about and how it is kept safe within the cabin, so that there is no contamination that takes place. Over and above that, the aircraft that comes in and lands in the various airports, how do we keep the aircraft clean and safe? Now, a lot of ground handlers take charge and provide their services when they are handling the aircraft whilst it's on ground. Just for information, you may have an aircraft down for 1 hour, but because of the stringent specific time that is given to the various service providers, cleaning takes place also with precision timing. If it is an aircraft that is down for a short transit, maybe 25-30 minutes, only about 10 minutes or less is given for the cleaners to go in. As soon as the passengers are offloaded, go in, 10 minutes, you clean. They spread all over the aircraft. They ensure that the total aircraft, this is a combined activity slide, how the aircraft is cleaned, and the aircraft cleaning for that in 10 minutes you will be wondering how they make the aircraft super clean back again. It is disinfected to ensure that aircraft safety is always there. You see in the pictures. So the cleaning and disinfection takes priority to make sure, especially during these periods where confidence has gone down in trouble. So the aircraft is cleaned, reset, all over the cabin. It is in the toilets, it is in the galley areas where food is prepared, it is in the main cabin, the cockpit, everything goes through quick cleaning, quick disinfection, and off we come out of the aircraft. Now, how this is so is, it is only transit that I've said. There are aircrafts that have longer ground time, 1 hour, 1 hour, 10 minutes, and more cleaning is done. And throughout the day, wherever the aircraft lands, it is cleaned, disinfected for passengers to make sure that it is already there, cleaned and safe for you to fly. For aircraft that has already completed its operations during the day, we call it night stop. Aircraft comes to a night stop, and during night stop, extensive cleaning of 1 hour or more is given to the cleaners to really remove all rubbish, debris, everything that is spillages on the carpets, marks on the doors. All these are cleaned, thoroughly gone through. Quality assurance ensures total quality in cleaning and disinfected after the cleaning is carried out. Now, for disinfection, we have various means of disinfection. The ones that we go through for transit aircraft, we do touch points cleaning. When I say touch points cleaning, this is the area where mainly, all right, the passengers touch. It's your meal tray, it's your armrest, it is the toilets, it is the galley areas where food is prepared. The cockpit will be only under supervision. The cleaners are allowed to go in because it's a highly technical area. And so the disinfection takes place. Now, the various types of disinfection, I've just mentioned the touch areas, even your overhead racks where you put your baggage, the latches, all these are disinfected. Over and above that, we have got the spraying method. You can either fog the aircraft or spray disinfectant on it. Or we have also the latest equipment, which is the automated spray equipment. Now, this equipment, we had it introduced because with this one disinfecting machine equipment, 1,000 meters, cubic meters is covered within 1 hour. So we can use this when aircraft, especially the wide bodies. Can you imagine a 380 aircraft on ground for cleaning and disinfection? A 747, which carries about 400 passengers on board, all the seats, and it is all disinfected in a very professional manner. And what you see on the screen is that equipment that is used for this. We call this bio-disinfection. So just for the safety of passengers, the various types are touch points disinfection, spray method, which is either fogging or spraying, and finally the automated bio-disinfection services. Ladies and gentlemen, with all these measures taken by the airport authorities when you come in, your temperature and everything taken, airlines that they do, which do their part to promote cleanliness, safe travel, the regulatory bodies and the ground services that is provided, it is by all standards safe to travel by air, resulting in safe tourism. Thank you very much.
Thank you, Thank you, Mr. Kanesan, for the information. Very interesting to know how aircrafts have been cleaned and sanitized. And thank you again. Ladies and gentlemen, I'd like to call upon Dr. Murali from the National Cancer Society, a good friend of mine, to share his ideas on safe tourism. Dr. Murali, are you there? Okay, we will move to the next speaker as maybe Dr. Murali is having some challenges with the Zoom. We would like to call upon Dr. Eddie from Indonesia, Bali. Dr. Eddie, over to you.
Hello.
Yes, Dr.
Hello,
Eddie.
Dr. Sri.
Yes,
Can you hear
yes,
me?
yes, Dr. Eddie. I
My
can hear
name is
you.
Dr. Daddy, not Eddie.
Okay,
But
sorry.
everybody calls me DK instead of Daddy because
Okay.
nobody knows me. Because nobody knows Daddy here in Bali. So
Okay.
actually, thank you for the opportunity given to me to speak about this issue. And I was so surprised whenever you asked me to deliver this issue because I'm not the most right guy to speak in this safe tourism. So that I asked the head of Provincial Bali Health Office to guide me in this issue. So I hope I can represent them to speak about how Bali is quite safe for the tourism during this pandemic relief. Okay, so without further ado, may I present my presentation?
Yes, you may, Doctor.
Okay. Okay. So I focus this presentation just in Bali, yeah. So you know about our preparation and our anticipation toward these pandemic issues. So this is our recent situation on November 11, 2021. So you can see that now the cases is quite declining, yeah, so significant. So daily confirmation cases, it's only about 4 cases every day. And also the cumulative confirmation, you can also see that now is going down, and the recovered is going up, and the death is going down, and then the treatments is going down also, and the positive rate and the case fatality rate is going down. And also, of course, we have to compare these numbers with the previous numbers. So I can show you the graphics. Yeah. So you can see the trend. They are declining now. So I think I can say now Bali is quite safe. And this is the recapitulation of the condition of Bali pandemic issues. So actually, for the vaccine, the first vaccine, we are now exceed more than 100%. So it means that some people coming from outside Bali is also vaccine in Bali. So for the vaccine, the second vaccine, now it reached about 87%. And for the health workers, we are also getting 103%. So you can see the description here, the progress of our province, yeah, to face the pandemic. Okay, And this is also our condition now by November 11, 2021. So now we are in the level 2 transmission. And it means that the confirmed cases is decreased, hospitalizations decrease, death rate decrease, positive rate now is below 5%, and more bed occupation ratio in hospital is also decreased. So it means that our hospital is quite adequate. It's quite sufficient to take care of the cases. So it means also tracing is our challenge, but the testing and the treatment quite comply. So this is our facilities to anticipate the COVID, yeah, or maybe the coming Omicron. Our hospitals dealing with COVID, yeah, is about 62. All the hospitals in the island is 71. And the non-intensive isolation beds is 2,591. And the intensive isolation beds is about 355. And the PCR laboratories now is quite spread out, yeah, across Bali. So there are about 26, yeah. In the beginning, there are only 5 or 6, if I'm not mistaken. And all of the laboratories are centralized in Denpasar and surrounding, but now it is already spread out across the island. Okay, so this is our human resources. There is prepared for the pandemic. Yeah, so I think for the population of 3 million people in Bali, I think it is quite sufficient. Yeah. So you can see the internists, Dr. Penyakit Dalam in Indonesia, the pulmonary doctor, and also the anesthesian and the nurse dedicated for the pandemic. And there is also a special regulation according this international travel, because we are now already open border, and we are now welcoming the foreigners to come to the Bali. So on arrival, there is a requirement for international travelers to take a RT-PCR, yeah, and also for the Indonesian, yeah, they are also required to get the second RT-PCR to come to Bali. So at least those 2 points is the requirement, yeah, for those who want to come to Bali. So basically, at most point we are already anticipate, yeah, at the airport, at hotel, at the tourism destination, and until departure to the country origin. So it is quarantine requirement, yeah, for those coming to Bali, even both Indonesian or foreigners, yeah, for 5 days or 3 days, it depends on the condition, yeah. But we already anticipate all the spot, all the points that might be become a risky spot. Okay, so we also have a special application, yeah, we call it the Peduli Lindungi, or in English we can say Protect and Care, and it is issued by the government, the central government, particularly from the Department of Informatics, yeah. So all the foreigners, all tourists coming to Bali must install this application, so we can trace and we can track also, yeah, everybody coming here in Bali. So this is the action plan for the Peduli Lindungi. It's been about 3 months already, yeah, working effectively, but it is already announced about 8 or 7 months ago, yeah, but effectively working about 3 or 5 months ago. So in Bali, at least there are 3,127 locations that required the apps. Yeah. So if you want to come or if you want to enter the location or the hotels or whatever, yeah, they will ask you to scan the QR code, and then there is a record that mention that whether you are already vaccinated, yeah, how many vaccines, yeah, or RT-PCR or etc. Yeah. So if you are not vaccinated, that they are not allow you, they don't allow you to come to the place. So there are also 935 QR codes are installed, yeah, in every domain of business, yeah, including trade, transportation, tourism, factories, and offices. And also we are cooperating with the Bali Police and the task force for the socialization and enforcement of health protocol in public areas. Okay. So this is our referral procedure. So don't be shocked whenever you want you come to Bali. Yeah. So at least there are some point of checking. Yeah. Even before departure, you have to make sure that you are already vaccinated or get the PCR test. Yeah. And then also thermal scanner whenever you landed in the airport, and then also in the Bali entry registration checkpoint, and then checking for the health documents, and then you have to go to PCR test, and then after that you can wait for someone picking you up, yeah, and then if you are positively COVID, yeah, then you have to go to the hospital. But if you are negatively COVID, then the passenger will be picked up to the transit hotel. So the travel principle during pandemic, yeah, all the destination, all the hotels, all the places that you have that you want to visit must apply this CHSA. Yeah, so we know that already. CHSA stands for cleanliness, health, safety, and environmental sustainability. So every stakeholder must prepare to welcome tourists, yeah, and health protocol must be applied throughout public service by applying 3M. We have this kind of motto 3M, yeah. So actually it stands for masker, menjaga jarak or maintain, and then wash your hand, or in Indonesia membersihkan. So there are 3M, then we call it this 3M procedure in the public space. Okay. And also there are health protocol must be obeyed, yeah, must be complied by the attraction managers, yeah. So this is the procedure that they must to provide, yeah. They have to understand the emergency aid procedure. They have to limit the capacity of tourist attraction, and it depends on the what kind of places, yeah. Hotels is quite different with MICE event places or recreation, yeah. So it up to 25 up to 50% of the maximum capacity. Okay, there is also an obligation for the managers to give as much possible, as many as possible, the signs and things that are related to the warnings. Okay, and this is our certification. Yeah, so the minimum standard is the Bali Era Baru certification. So it is issued by the provincial government. Yeah, but the right ones in the right side is the international certification. Yeah, we also call this certification as a CHSA certification. So basically, this CHSA is a combination of ISO 14,000 and ISO 17,000. Yeah. So if you have this international certification, it means that this hotel or whatever the places, it can join the travel bubble program. Yeah. But this Bali Era Baru certification is quite sufficient for the domestic tourists to come or to stay or to visit the hotels, yeah, who may not enroll for the international certification. because there are only 2,000 places that registered by now, yeah, for the international certification in Bali throughout the island. So this is the example of the recommended quarantine hotels in Bali, yeah. So if you want to make sure that you will stay in the safe hotel, so you better see this list. And this is the way we monitor the healthy and safe tourism. Yeah. So at least there are 3 monitoring teams. Yeah. We call it the 3M team. So 3M is the expansion of the 5M is the extension of 3M procedure. So 3M is if you are already in the public space. Yeah. But the other two addition point is it is better to moving away from crowd, and it is better to get a less mobility. So whenever you are already in the public space, then the 3M protocol is valid. Okay. So another team is a health protocol team, and this is consists of health office, the MDA. MDA means traditional village assembly or masyarakat desa adat, and also it includes universities. And then the other teams is a CHSE team, and it consists of Bali Tourism Office and Tourism Association or tourism stakeholders here. And regarding the policy implementation, all tourism-related business are required to have a CHSE or at least a Bali Ara Baru certificate. All tourism workers have received the 2nd dose of vaccination. And the tourist destination are required to use the Peduli or Lindungi application. Okay, so whenever you are already enjoy our island and then you have to go back to your country, there is also a procedure, departure procedure at Bali Airport, but this procedure is more simpler than the arrival procedure. There are only 4 checkpoints, yeah, that you have to obey. Okay, I think that's it. Our presentation, yeah. Thank you, and we hope that you will come to the Bali soon. Thank you.
Thank you, Dr. Dedi. Thank you very much for the presentation. It is very interesting to see how the tourism board in Bali has taken the initiative on the 3M, 5M, and also the Peduli app, where you all have kept it in a few places, about 3,000 over places in Bali. And also the 1400 ISO. I think that is something that is very interesting to see, that it gives a lot of confidence to tourists when they come to the hotel. Thank you very much for sharing, and we look forward coming to Bali, and thanks a lot, Doctor. So ladies and gentlemen, now we will call upon Dr. Murali, a very good friend of mine from the National Cancer Society. And Dr. Murali, over to you.
Okay, good morning, Dr. Sri. Thank you so much for the invite. Thank you so much for joining us this morning. Sorry, I think there was a kind of a delay within my internet. I couldn't present earlier. So actually, I'm just here to talk to you, ladies and gentlemen, very quickly and give you a very brief overview of this perspective on when we're talking about safe tourism. I think the healthcare aspects that we really need to look at and just be extra careful about, because as we can see with the latest kind of introduction of the next new variant, Omicron, I think we're looking at the biggest challenge is going to be to the travel industry, and of course, concurrently to the tourism industry as well. Now, so I'm going to speak very quickly to you guys. I have about 10 minutes. And I want to speak to you, ladies and gentlemen, about looking at this from 3 different angles. Yeah, one is from the perspective of the visitor or the tourists themselves, or shall I use it's probably easier to use the term clients, okay? The second perspective is from the human resource perspective, meaning the staff that we are actually putting into place into working in these sectors. And the third, of course, is the institutional perspective, which is the perspective of the hotels, for example, the airline or the airport operators, the kind of institutional perspective. So these are three things you really want to kind of consider as we transition slowly back, so that the idea is that so that there is no more reversal, in the sense that, for example, let me just paint a very bleak scenario. All you need is maybe, as we saw last week, 10 people, 10 passengers out of a flight that was boarding from South Africa to Netherlands ended up testing positive for COVID. And at this point in time, they couldn't get the PCR kind of subvariants back in terms of genomic analysis to decide whether or not they had the Omicron variant. So as a result of that, everyone who was exposed to them, meaning the baggage handlers, your airport personnel, your airline personnel, subsequently these people are going through whatever the handling that there was, that whole set of value chain, the human resource chain, actually have to be quarantined, taken out of commission. So you can imagine, in terms of an institutional perspective, how much that's going to be in terms of costs. So these are things that we really need to kind of think of very properly. So one, in terms of the tourists themselves, okay, and I'm talking here about mindsets, as well as what are they going to be, what's going to be their prevalent kind of practice. A lot of people who are on a holiday, whether or not they kind of realize they're going to be switching off their kind of care threshold, in the sense that they will be probably very, very relaxed in the sense of they're going to be a little lax with following SOP. So there will be a consistent and constant need. I remember, I think even our colleague speaking previously from Bali was mentioning, Dr. Dedi, I think, was mentioning to us about how the different testings are going to be and all that. But I'm speaking in the context of someone who's already been tested negative, but may be in the incubation period. And this is something that no one can kind of control. So if you cannot control the kind of window period between incubation and acute onset of symptoms, or as in the most case that we're seeing now, asymptomatic presentation, where people don't have any symptoms, but they're still continuing to be positive with COVID-19, and more importantly, spread COVID-19. Two very dangerous things that are going on, okay? So within the window period, okay, they may be already carrying the disease. And when they kind of touch your surfaces, they kind of move within the airport and within your travel areas, these people may be contaminated. So, or they may be contaminating the rest of the public. So a couple of important points to note is, while we cannot guarantee, okay, that these individuals may or may not be carrying disease, we can put into place very rigid protocols which are in place. But I'm here to talk to you about the need for consistent and constant enforcement. These are two things which on the ground we have found to be very, very lacking, especially from personnel who are working every day. I unfortunately had the opportunity, or I don't know, the misfortune to serve in an Ebola setting many years ago in Sierra Leone. And I watched firsthand how very, very trained medical personnel also succumb to something called medical personnel fatigue, where after many, many days of doing the same thing, for Ebola, for example, we have to wear a hazmat level 4 suit. Okay, and after wearing a hazmat level 4 suit, you actually have to wear adult pampers. You can't eat or drink during that 8 hours. You have to wear something like 3 pairs of gloves and a lot of other external coverings. Working in the extreme heat in Africa at that time is very uncomfortable. So, and at first, when we are working there for the first few weeks or so, you're very careful, you're very scared, you're very concerned. So you follow all the SOPs. After a period of time, you start getting a little relaxed. in the sense that you're supposed to double mask, instead you'll wear one mask, these kind of things. Or you're supposed to wear a glove all the time, you'll be like, yeah, I forgot my glove, so things like this will happen. So, and when that started happening in Africa at that time, medical workers, meaning the professionals who were working there themselves, started to die from disease. They caught Ebola and then subsequently they died. So after a while, the WHO and other organizations realized that we can only keep these people working for a period of about 3 months in a certain sector before they had to transition them out, because that caused them to get lax. And when they were lax with procedures, they started to get Ebola, and which Ebola is of course a much more lethal disease than COVID. But consider this as well, that kind of a COVID-related shutdown, I think, will be lethal for many businesses, especially within the sectors that all of you all are working in as well. So that's going to be quite a big challenge that we need to be very, very careful about. So one of the big take-homes in terms of personnel is going to be ensuring, and this is both from the institutional perspective, because it's cost saving, as well as from the personnel point of view, because it is life saving. Because despite the vaccines, with the kind of onset of newer and newer variants, which may or may not be more lethal, we don't know, but there's of course a smaller percentage of people who are still vaccinated and still dying because of their own comorbid conditions. So unless the industry is really going to be only limited to employing 20-year-old young people, we are all going to be putting our colleagues and ourselves, like it or not, they will be at risk. So coming back to enforcement of processes. So rather than merely having policies in place, okay, I think you need to pay a lot of attention to devoting specific personnel to ensuring that the processes are followed. Okay, what do I mean by this? Sometimes we, even in my institution originally, it's very easy to write policies. We write policies. No one actually knows whether they are being enforced or not. And the only way that we can ensure enforcement is to put in enforcement officers, meaning specific personnel tasked to enforcement. What do I mean by enforcement? For example, somebody actually needs to go around as part of their work day, meaning there's a job sheet tasked to this person. In some departments, in many institutions now, we have something like a enforcement officer, and that person is now tasked maybe for a week. They put them on a duty roster. This person now walks around, makes sure that, okay, everybody's wearing masks, for example, or making sure that everybody is following the processes, making sure that staff, for example, are eating only in designated areas, because something as simple as that will require you to actually remove your masks and all that, and then re-expose yourself to kind of closed circulation, and then in that transmission can happen. This is for a lot of your waiting areas and such, staff working within these areas. So even things like decontamination, everybody wears a mask and then they all take it and throw it in the locker room, not even within a secure kind of bin, and subsequently everybody's going in there and changing and all that. And so you're wearing masks to the outside world, and then in the place where in a closed kind of tight airless environment, we are exposing ourselves to all the masks and the contaminants that those masks are bringing, for example. So things like that need to be put into action. Waste disposal, especially of hazardous material, such as your PPEs, need to be considered as well. For those, you see, a lot of PPEs, when we started off, okay, where we were looking at recycling at single-use items. Now we're increasingly looking at recycling, for example, whether or not you need to institutionally work out as well. Is it cost effective to buy a lousy single-use surgical mask, or even most institutions are not even using surgical masks, yeah? They use some low-grade 3-ply, which is of low quality. It just looks like a 3-ply. It doesn't even feel like a 3-ply, and God knows it's unable to filter out any kind of significant microorganism. So you need to also look at your quality assurance in terms of the protective equipment that you're putting in place. But my question will be, is it cost effective to kind of use these 3-ply masks which you're throwing every day and consuming in huge amounts, or is it better to give an N95, okay, to each personnel, which now we know that N95s can be put out into the sun or into ultraviolet light for a total of about 5 to 8 minutes, and then they're actually cleansed enough to be reused again. They become totally, sterile again. So these are protocols that you can Google and find online. A lot of big institutions, including the CDC, have looked at how to reuse and recycle, and this is a huge saving of cost, because compared to an N95, which maybe you can use for a whole week, and then, compared to every day, people are just pulling 3-ply masks and throwing it all over the place, and that is a significant cost as well. Things like that need to be considered. Also, again, addition of cloth masks, which are very beneficial, that can be used as a branding exercise. A lot of institutions, again, including like mine, we use that as a form of branding. All our cloth masks are actually using our institutional logos to brand, and that may help to kind of put out some branding. But more importantly, because cloth masks are cheap, they're reusable. Because again, all a cloth mask needs is to be rinsed in soap water at the end of the day and then dried out, and then they can be reused. I will never underestimate the importance of face shields. But again, face shields, and here's where even last week, 2 weeks ago, I took a flight, and to my amusement and fear, I saw that most of the ground personnel were actually wearing face shields. Those nice expensive face shields, like a helmet like that covering, but without wearing a face mask, which to me is a joke, because it's the masks that actually are the protective item. Your face shields only act to stop any kind of spatter, like from your mouth or nose and all that. But particles traveling within the air, and now we know, like for example, COVID-19 is airborne in close distances. I think that's going to be a difficult thing for you to kind of not kind of be aware of. Okay, I think Dr. Dedi and other speakers this morning spoke about sanitization in terms of physical sanitization. And that is, I agree, a very, very important component. But however, do not forget the kind of basic hand sanitization, which although looks to be almost very too simple, so we ignore it all the time. Again, that's something that your personnel need to be constantly drilled into. It needs to become habitual. Currently, it's not. So it's more or less like you have to actively police them until it's built in. Because, like I said, it's very difficult for you to police your clients. Okay, so if you can't police your clients, you need to actually protect your personnel. And one of the main ways to protect your personnel is by ensuring that they are safe through their own measures. Okay, a lot of institutions are kind of very concerned with how to say, protecting the clients. So you want to test your clients RT-PCR, RTK and all that. But for personnel, we're a little bit lax. So have that threshold of fear in terms of if they are symptomatic, if they report symptoms, have ensured that a lot of people, again now, like for example, when you originally started checking into many places using our QR code or identification app and so on and so forth, daily we would diligently mark off whether we had symptoms or not, and all those kind of issues. Nowadays, people have learned to skip past that, press no or something, and just go ahead and just scan themselves in. So reinstitute these kind of processes where they need to reinforce every day whether they have symptoms or not, because that's still one of the strongest ways for us to detect. Again, for me, I mean, for a longer discussion, maybe not in this forum, is I want to highlight also the use of passive protection measures such as ultraviolet lights. Ultraviolet lights are cheap. So many brands, including a lot of Chinese brands, many locally used brands as well, and they cover a wide area up to about 10 meters squared or 10 meters times 10 meters cubed actually. So and they cost very little. A lot of institutions I think have now big use of ultraviolet lights. We're finding out more and more, a lot of good evidence coming back from the use of ultraviolet lights as a passive form of disinfection, meaning after everyone has gone home or before you start the operations for the day, switching on ultraviolet lights all over the institutional floors and all that, including within changing rooms and all that, actually managed to kill off anything, including latent kind of inert COVID-19 microorganism, as well as everything else as well, which is there. So again, my whole stress, I'm just ending this with saying that it's the human factor, again, more so than anything else, that will be the decision that will play the biggest role actually in ensuring that tourism continues to run safely, because it's not going to be anything else that fails. It'll be the human kind of element. No, so as employers, as institutions, you need to kind of make sure that your staff who are in the front line, they are the ones who are the best equipped to deal with this. And we need to kind of provide that kind of institutional support to ensure that things are being done well, and things are being done consistently throughout the entire process. That's pretty much all I have to say. Thank you very much.
Thank you, Doctor. Very spot on. I think the challenge that we have is to have the enforcement. Yes, we have a lot of regulation, especially in hotels, in resorts, golf clubs, and also in the tourism industry. But I think enforcement is something that is lacking, and this is going to be a challenge. Thank you very much, Dr. Murali. And now we'd like to call upon Prof. Selvam. Prof. Selvam and myself, we share the same alumni. We worked in Gentings before. He was my senior. And we reconnected back 3 weeks ago. And I would like to call upon him to say a few words. Prof. Selvam, over to you.
Hi, everybody. Good morning. And esteemed colleagues, so pleased to see all of you here, including Dr. Murali, who was just ahead of me, talking about health issues. I do know Dr. Murali personally as well, and I know his passion for safety and health. What I like to talk about after listening to all my esteemed colleagues here is the psychology that's going to affect people. And we have, it's almost like a battle zone now. We have two elements. One, the tourism industry that's struggling and, gasping for air, literally. And on the other hand, the traveler who is suppressed. A suppressed traveler is just waiting to burst out of the bubble, get out of the closed doors, locked rooms, and let the hair down again, that kind of feeling. Now, the important question we have to ask is, why do people want to go on a holiday? People want to go on a holiday to let the hair down, literally meaning do all those things that they cannot do, or mostly cannot be done in their own homes, which is partying, unlimited, expensive time out, socialization, and so forth. So if you're looking at it that way, and looking at the contrast that we have on ground now, with all the safety measures that Dr. Murali so rightly pointed out, that's so necessary for safety. Now, this is going to be a complete contrast to what's going to happen. So one is, the safety element is very essential, especially in these times. We just had a new variant. We do not know how many more variants are going to be there, or what will be the evolution of this pandemic. It's really unpredictable at this stage. However, we cannot put things on hold, as the whole world is crying out to release all the bars and blocks that have been put up to sort of contain or curtail the spread of this illness. looking at it from both sides, it's going to be a difficult adjustment. However, I think the first adjustment that we need to accept is acceptance. We need to accept both sides of the argument that we need to be safe, and at the same time, we need to be vigilant and also be able to relax and curtail some of those people who will be tempted to break the rule. The rule here meaning the SOPs. Now, it is a human tendency. When you tell someone, don't do that, even as a child, if you tell a child, don't do that, that's exactly what the child will want to do because of the word don't. So this is something I think we have to take into the first phase of the framing. How do we frame the requirements? If we say, do not go without a mask, I can bet you everybody will be trying to go out without a mask. I mean, that's my opinion anyway. If you say, do wear a mask, please, and I think that's appeasing to the unconscious mind that you're being very submissive and you're requesting for a mask to be worn. So these are some things I think we have to bear in mind in the art of communication during these difficult times. Mr. Ganesan spoke so eloquently about the travel industry and how much they are striving to sort of keep things in place. And me having a lot of involvement in the travel aviation industry, I'm aware of all the stringent measures that every department has to comply with to keep things in place. But we do know that many people still to this day, if given a choice, will not wear the safety belt just before takeoff. They will think of ways and things of, just sticking the belt as though it is fastened. And when you tell them, please keep your seatbelts fastened, they still will be annoyed and many will try avoiding it. So coming back to the point is how we phrase the requirements is very, very essential. How we educate them into the psychological needs is going to be very essential. Because the basic element of them going on a holiday or travel or be a tourist is to escape the containment, just not physical containment in their homes or offices or by work, but in a psychological containment. So escape from the psychological containment has to be taken into consideration when you want to frame the restrictions, the SOPs, and again, instilling fear into this infectious situation is also going to be a negative factor. Now, we know that COVID is here to stay, and our aim is to make just the conditions safe, the environment as safe as possible, and provide all the tools for the people involved to remain safe. So by complying with all these three, then the fourth element, which is a different dimensional element, which is the risk assessment or the risk factors. By minimizing the risk factors, we hope that in some ways, the risk of containment, the risk of infection and contamination is minimized. We hope the travel industry, which is waking up slowly, will have the benefits of allowing people to have a psychological release and a physical release in more than one way, but at the same time, does not become a deterrent and we all go down to a complete lockdown again. So with that, with those few words of being careful about how we phrase and how we look at psychology, I would like to say thank you for having been given this opportunity. And I hope the travel industry all the success in the future. Thank you.
Thank you, Dr. Prof. Selvam. Thank you very much for the short and interesting area that you touched on the behavior of tourists. Yes, we face it when we work in the hotel. When we say don't do something, they will go and do. I mean, this is a normal thing that we experience, And this is something that is very interesting, that needs to be looked into. And thanks again. Now I would like to call upon Dr. Razif, a colleague, a great friend of mine. He's the president of the Tourism Educators Association Malaysia from UITM, and also the consultant of IBE. So, Dr. Razif, over to you.
I also have friends from China here, Dr. Zoe and Sir Jojo from the Philippines, and my Dr. Dedi from Indonesia, and also other colleagues. Good morning everyone. And I'm pleased to be here. I also enjoy your presentation by the previous speakers, panelists that talk about the safety. And today I would like to just share a little bit of my thought on this topic. And I think this topic is not new to all of us because we have been discussing about the safe tourism for like since the starting of this pandemic. And today we keep revisiting, and we want to share what is the progress or the current state of this safe tourism. Allow me to share my screen, and I hope all of you can find my screen is visible to all of you. Okay, so talking about this safety and security, I would say that there have been many discussions or many variables or many equations that being brought up by the previous scholars. For example, before this, when we talk about the safety and security, we always talk about the public safety, how we want to ensure the public safety and the health safety, road safety, and we look into this political instability. And sometimes there's a travel advisory boards that discourage people to go to certain countries because of the political instability that happened to that countries, and the internal conflicts. Sometimes we heard the news on ethnic or religious issues within the countries, and then the crime, the criminal reports, as well as natural disasters. So this is the basic foundation of safety and security. And moving on, and they have been a discussion. You can see that in the new millennials, when we can see cases on the terrorism and the people coined with the new words, they have to start using this safety and security, try to put things in place, especially in the air transport, and then manipulation, because people can see, when tourists come and when there is no facilities, then they can manipulate people. So the kind of incidences happen, like a lot of incidences happen previously. And then we also look into this hygiene and sanitation. This one brought up by the previous speakers on this hygiene and sanitization, especially during this pandemic. And these incidents like petty crime, fraud always happen before this, and the local government or authorities trying so much to reduce this crime because it will tarnish the image of the destination. And finally, the facilities management, because there are lots of accidents occurred due to the weaknesses of the facilities. So that's why sometimes the agency come up with a rating, try to rate these facilities, because we know, for example, the restaurant facilities, you see the rating A, B, C, then you know that it is risky for you to patron to that particular facilities. So that's why today we move into after 2000, and they have been discussion on the data protection, for example, omnipotent, as well as cybercrime, because during that time people talk about this data protection. So what will happen to our data, our personal information that we share with the service providers? So that kind of thing is really something that people make it people really look into that matter, and people want to make sure that all the personal information that they share with the service provider will be safe, will be kept in the right place. Okay. So that's why there are two things being people or the scholars, the industry players, or the authorities, agencies trying to come out. So the best way on the risk management, because when we talk about this risk management, we talk about how we want to prevent the incidents or accidents to occur in the future. So it must, we depend this on the pattern, we depend this on the data, and also the smart analysis that we have from the data that we accumulated for years, right? And then for this crisis management, so when you want to react to the incidences to any accidents that happen, or any incidences, bad incidences that happen in the country. So we must also have this in place. So we need to record, or we need to report, or maybe we have to make it as one of the legacy in the system where we can prevent this thing to occur in the future. And for that, I would say that maybe some of us, maybe all of us here know about this safe travels mechanism or this protocol, introduced by the World Travel and Tourism Council in this year. And they have come up with these global protocols and stand for the new normal way, where if, let's say, you adhere to this protocol, then you can get stamping or you can get certificate stating that you adhere to the protocol. So this one is based on the various measures, including the World Health Organization, as well as the US Centers for Disease Control and Prevention guidelines. So you just want, I think if you look into these websites, you can see lots of protocols or procedures that they want to, to make the industry players adhere. But at the end of the day, we want to look into several. For today, I just want to see several protocols, for example, in the hospitality. And I think all of the protocols listed here are not new to all of us. For example, like what I highlighted here, to develop a COVID-19 prevention plan, and then the checklist, as well as the protocol and guidelines for staff safety and health. So I think most of the industry players comply to this. We have no issues so far, but somehow, how do we want to maintain this? How we want to ensure the compliance remain high, the rate of compliance high. And then the most important thing is to evaluate the innovations and cleanliness of disinfection. So using the technology, using several gadgets, several devices, because we want to comply with this. And for this one is for the first one, operational and staff preparedness. And we move on to the next one to ensure the safe experience. So this is really critical for us today, where we want to see into this processes. So the processes of ensuring this safe experience, and it is critical for the service providers to ensure that they comply with this. So if, let's say, the industry players, or especially the small industry players, the budget hotel, for example. So if they can comply with this, it will be safe to say that people can come to Malaysia, because we have ensured all the industries have been making this in place. And then we also want to rebuild trust and confidence. I have to agree with this, because it must be clear, and we have to make sure that it must be consistent. For example, the way we want to communicate, the policies that we have in place must be standardized, and it must be shared with all the industry players, with all the industries and sub-industries. And finally, for this implementing or enabling policies to, again, in fact, the World Travel and Tourism Council also look into these areas. We have to ensure that the industry players work collaboratively with the governments for these new rules, because we want to bring people come to our border. So that's why, in order for us to start thinking of this cross-border travel, so we must work collaboratively with other, nations. So that's why it's important. And the next one, to provide financial relief to the sector, because of definitely they need this reduction of taxes fees, because we want to stimulate the demand. So that's why sometimes they have to offer slightly lower price, lower package to attract people from abroad to come to our shore. And let's move into this outdoor shopping. And from here, you can see that there's not so much difference between the outdoor shopping and the hospitality. But at the end of the day, they have this, we can comply with this. We can look into our industries, whether we have this in place. And then, for example, when you want to ensure this, outdoor, and we also have to look into these areas, and then rebuilding trust and confidence, and also integrate innovation, because this is the right time for us to come out with innovation. Because this moment, from 2020 and maybe until 2024, this is the right time for the industry to start introducing innovation, start collaborating with the with other industries to come up with the best practice to ensure safe environment. And for aviation is the most responsible from across all of this. And I would say that somehow when we look at this, we look at the protocols at the airport, health and hygiene measures. And I would say that if you go through this, you go through the protocols from number 1 to number 9, and I would say that we are ready. But somehow, even though we are ready with this, but the government still, hesitant to reopen the border because of definitely in the future there must be violation or maybe a non-compliance by sometimes the small sectors that we want to avoid that to happen because we don't want to to increase the cases. And suddenly so far like in Malaysia we have started to to have cases less than 5,000. So people start feeling safe, relief about the current scenario. And you can see that the most important thing here when you look at this, it looks at how not only the industry players but also the government to ensure the system must be in place and to ensure that it will give confidence to the travelers, to the foreigners to come over to us. Because we must make sure that we take care of them. We cannot take care of them by looking into every travelers, but using the right policies. And then you look at the Thailand and Singapore, they always communicate. For example, because we rely so much on these international travelers like Thailand and Singapore, because not only the tourism industry but also other industry rely so much on these international travelers or international business travelers. So that's why I would say that this one might change. Sometimes it change overnight, but at the end of the day, we need to be consistent with what we want to do, especially for Malaysia, that the government will allow international traveler or vaccinated traveling starting this first December or maybe starting early next year. So at the end of the day, the communication must be transparent or must be, communicated or must be well disseminated to the people. Okay? And finally, so we also need to make sure for the complying because the basic security framework of this post-COVID-19, we need to look into this. These 3 stakeholders, I would say, must play a pivotal role for this to ensure that our country is safe for the international travelers. For example, the policy and execution must be there. So, for example, you look into the policy or the guidelines that I shared with you previously. The one was introduced by the World Travel and Tourism Council and had been used by many countries. If you look into the website, you can see that there are many countries. In fact, in Southeast Asia, lots of countries already comply with that guidelines. And the legal framework and the media relation is important because we want to make sure that they know the process that we have been doing so far to ensure that it will be safe for them to travel to us. And then for the tourism industries or the tourism agencies, industry players to come up with the right package and make sure to include the insurance. I think it's better for them to, maybe they can help to assist the travelers with the insurance. Because sometimes you want to give package to them, but somehow you say to the travelers, you must have the insurance. But sometimes we never know the insurance coverage when you want to travel to us. And if let's say they arrive in Malaysia or arrive in the destination, when we look into the insurance, suddenly the insurance does not comply with what the nation or what the country suggests, and the competency and compliance. And finally, for the communities, it's not only the government and tourism agencies, but also the communities, especially the hosts, the service providers, the host providers, to ensure the preventive policies must be in place. Just now I mentioned on the words, it's preventive, and they must come up with these preventive measures. We don't want to just, to have this kind of reactive. After the incidents happen, then we react to it. So we want to prevent things by controlling the risk. and also finally to make sure that all of them must be up to date with all of the new compliance or new protocol that introduced by several agencies. We have to share with them, and I'm sure that today not all of them know about the latest scenario or the latest protocol by these world governing bodies, right? And finally, so this is important. So far, we heard about this compliance report like 90%, more than 90% of the industry players comply with this, but we heard the cases, the non-compliance cases where the industry players were fined because of they don't comply and they don't really they don't really follow the protocol. For example, they have capacity. So that is important. And I would say that for us to make sure everything can be done or can be executed in the near future, this is the most important thing, the compliance report. If you can get the compliance, not only the general compliance report, but it must be more specific to the sub-industries so that we know what we can do, what we can assist to that sub-industries. For that, I think that's all from me. Thank you. Back to you, Sri.
Thank you, Dr. Razif. Thank you for sharing. Very interesting to see from the world tourism what they have given the guidelines, and you also mentioned about Singapore. I think it comes back to the point that Dr. Murali mentioned just now about enforcement. This is where that I think countries in Southeast Asia they should look at enforcement, not from the enforcement officers, but from the company itself on the enforcement on how to get things moving. This is something that is going to be a challenge, and also from what Prof. Silva was telling, we have the attitude when we say don't do something we want to do. So this is something that is going to be a great challenge. So thank you very much, Dr. Razif. And now we'd like to call upon Dr. Yi Zing. She is the Vice Director of Institute of Smart Tourism, Hao University in China, and we'd like to hear her presentation. Dr. Yi, over to you.
Okay, so can you hear me clearly?
Morning, doctor.
Morning. So I will share my screen.
Okay.
Should you see my slide? Is that okay?
Okay, we can see.
Okay, so good morning, everyone. I'm glad to have this opportunity to share some of my study on the tourism, safety and security fields, especially under this very serious virus background. So my study is on the network public opinion and tourism emergency management cooperation mechanism. So originally I made this study with the corporate network with China and Thailand. For this similar, I want to expand it to Malaysia. So let's see some data before the COVID-19. Before COVID-19 breaks out, China has become the world's largest outbound tourism market, and its outbound tourism consumption expenditures rank first in the world. So you can have a look on this map. And affected by the growth of the per capita income, the increase of international routes, and the increase of the growth content on the Chinese passports, China and the younger generation, they have quite a lot of enthusiasm to go abroad. And so for over the past years, Chinese tourist overseas consumption has become more rational, and the growth rate outbound tourism consumption has slowed down. But China is still the world's largest outbound tourism expenditures country before the virus. And for the China and Malaysia's tourism cooperation, so according to the data in 2018, Malaysia received a total of 2.9 million Chinese tourists. And that is an increase of 29% over 2017. So it means that if we don't face a huge risk from the public health, we can see a bright future for China and Malaysia's outbound tourism. So we now face some quite issues for the overseas travelings. You know, China has a very strict policies on the virus since we pursue the zero COVID-19 influence. So as the number we continues to rise, before the COVID-19 we collect the major issues in the Malaysia tourism markets. We now have some topics on the terrorist incidents, and we also have some security concerns besides the natural disaster things. And every year, the administrative department also will send out some warranty for the Chinese tourists who comes to Malaysia to have the traveling things. So that is some current data here, and we can see this map. And so still, we will face some challenges from the new media. So with the fast development of the tourism industry, we know the young generation would like to collect or to search where is the most pleasing place to go, or where is the most safe place to go. So we have some data from the China and Thailand big data and social media investigation data to analyze. And here we have organized and put some major incidents we have now from the view of the online public opinions, such as the Facebook, Twitter, and for the Chinese version of Twitter, Weibo and the WeChat. So with the sustained analyze, the major type of tourism incidents have been included. The first one will be the public health events. I'm not sure what will the virus, if these will be the hot topics in your country's young generation, but for China, every city or every tourist destination, they have the breakout of the virus. It will suddenly become the top issues in the national social media. So for the tourism industry, the first and the major potential risk will be the public health events. And besides that, we have some traditional incidents. The second one will be the natural disaster and the extreme weather. And the third will be the high-risk tourism activities. In Malaysia, we have some activities like the diving, and we have the jungle jump. These high-risk tourist activities will also be the hot topics and the barriers for the healthy development in the tourism industry. And we still have some social security problems and the tourism rapid. So first one, we can have a look at the public health events. And this is the map from the WHO. They estimate the jump of the data after the breakout of COVID-19. We can see here where has the huge decreasement from the 2019 to 2020 and 2021. They will be a huge disaster for the tourism industry. And we can see for China, for our university, maybe half of the graduates from tourism college, they change their occupations. They change from their role of the tour guide, from the OTA agency to financial managers to sales departments manage. So it will be a crisis for everyone in this industry. And now we have the new virus that will be the Omicron, right? It is a variant of the concern, and we can see from the map, from the news media, it is a huge attack to the airports, especially for the East Asian, Singapore and Philippines, right? And Japan and Australia, they implement to consider tougher restrictions to influx growth of the to travel. And for China, we have less than 100 days. We are going to host the Winter Olympic. So it will be the half open and half closed. The huge tourism related sports events in China. So that will be a huge challenges for us. And besides the public health events, we also have the natural disaster and extreme weather because of the global climate change and the global warming impact on our regional weather and the natural resources. We are relying to attract our tourists. And we also have some high-risk tourism activities like diving, jungle flights, and the water motorcycles. They are becoming more and more interesting in the in high-risk tourism activities, but they will have a high possibility to cause the number of deaths and injuries, and that will greatly influence on their intention to go to the destinations. And still, we have the social security problems, like the uncertain and unstable factors in the international situation are clearly on the rise at present. So that the terrorist attack, some
Ladies and gentlemen, we just have a small technical error here, and we lost Dr. Z. Now she is back. Okay, doctor, over to you.
sorry for my lost in connection, as maybe my internet was not so stable. Dr. Sorry.
Dr. Z, yes, you may present, no problem. You can hear me?
Okay, so can you hear me?
Yes, we can hear you, doctor.
Okay, so where do we stop? So we have the public health events, the natural disaster, extreme weather, and the high-risk tourist activities. But there will be also the triggers to attract the new generation, the younger generation, to enjoy the fantastic tourism, the traveling in Malaysia. But how to ensure they have the risky activity, and meanwhile they can be in the relatively safe conditions. That will be a very interesting issues we can go for the study. And still we have the social security problems, the tourism distributors. We know the different nations have a lot of difference in culture, language, religion, education, and social activities. So sometimes we have some arguments, we have some disputes happens occasionally. So for the travel agency, for the bureau, for the organizers of the overseas tourism, they may put some efforts to dismiss, to do the crisis management. We want that the misunderstanding to increase the maybe the bad perception for the destination image layer. Okay, so overall we have listed some characteristics of the network public opinions on tourism institute. So the first one, once we put some incidents online, the public opinions will spread very quickly. So the incubation period is short and spread progress is rapid, rather than regardless of the geographical barrier. So that is the first thing with the social media and the internet work. And the second, the tourism instance is more possible to cause widely online discussion. The tourism things, rather than the normal traffic accidents or the crime incidents, because everyone will put them into the role of tourist. So they will arouse even the public opinion crisis. And it's very difficult to conduct effective supervision and early warning of tourism incidents. And once we have the online hot topics with the local tourism incidents things, it will cost a lot to erase it or to lower the bad impact on the near future tourism income economics. So that will be the issues. And the same things, the network public opinion of tourism instance, it will greatly affect by the diverse array of complex factors. The people behind the screen, they would like to believe in some KOL online, and they will also believe what they have seen from the video, and they will take the majority's people's talk. So evidence, data, and some maybe the PR letter won't be so useful for the network public opinion to find a solution, a comprehensive solution too quick, because there will be a rapid progression, right? We need to seize the first day or two to lower the impact of the crisis from the network. And we set a mechanism to study the online public opinions there. I'm sorry, I don't have time to translate this framework into English, but we set up a big data network to collect the online public opinions of Chinese tourists. And we trying to do the pre-cost. So we identify the potential risk of each tourism destination, from the natural disaster, from the public health, from the high-risk issues. We trying to guard them. So we have put some marketing strategy to help lower the impact before the tourists actually come. And when they come to that destination, we will follow their social media, what they are talking about, and what is a concern. Is their concern is about the traffic, or about the weather, or even about the virus, the COVID-19. So we will transfer the message immediately to the local administrators, so they can shift their emergency policies quickly, immediately, to ensure the tourists have the satisfactory experience. And after some incidents happen, we will hire some crisis managers to help I'm not sure how to describe that, the enterprises, the agencies to do some marketing job and to do some PR job to quickly to erase that things on internet influence. So that is how we do it. So we would like to show, if we have the possibility, we would like to set up an tourism incident network, public opinion supervision network between our two nations on the traffic flow, logistics, and information flow. So we would like to share the real-time tourism information, because you mentioned quite a lot in the hospital, the medicine information, the air flight information, and maybe the intention of the two nations tourists there to go travel. And we have to search and collect the public opinion maybe 24 hours a day, and to more effectively supervise and manage the tourism incidents to lower the negative impact to both countries' tourism industry. And furthermore, maybe we can use the public opinions to shape a new image for the traditional destinations. Okay, so here we have some the mechanism here. We will cover the emergency recovery, the emergency prevention, emergency early warning, emergency response, and emergency control in the systematic results. Okay, so that will be the some small founding, and we would like to introduce what we have to do on the online public issues. Overall, so I would like to invite some of you who are interested in this topic. We can do more research between these two nations, and we try to set up the real network supervision systems to ensure that our tourists can have the more secure and more interesting information from our service. So that is all for my sharing. Thank you for Dr. Sari and other colleagues here.
Thank you, Dr. Yi. Very interesting from the perspective of the government of China's perspective of protecting their tourists. Yes, MH370 had a great impact on the arrival of Chinese tourists into Malaysia, and also the incidents that you brought forward on the kidnapping in Sabah, in the state of Sabah, and also the other incidents. But it is good to know that how Chinese tourists visit a country, that the areas that they look at on public health, natural disaster, and high risk social security and tourism dispute. This is something very interesting to know, and the types of actions that you all take, like emergency and the different types of emergency that you had mentioned there. This is, yes, I think we in iPortal, we will be glad to collaborate with yourself to see how we could work on this further, and how we can develop this to the next level. In one of our webinar that we had in the month of June, that was our first webinar on tourism in Port Dickson. One of the things that we spoke about was occupational safety and health in the travel industry, in the tourism industry. This is something that is lacking, and there have been many incidents in resorts, in hotels, where guests have injured and themselves or fallen off. There was one incident in Langkawi in one of the resorts. Indian tourists was at the resort, and they just fell off and died, hit the rock, from the second floor of their chalet. So this is something that very interesting, and thank you for sharing. Now we come to our last speaker, Mr. Jojo from the Philippines, who has been very helpful in all our webinars. And Mr. Jojo, over to you.
Hi. We normally say mabuhay in Philippines in welcoming our guests. So mabuhay to everyone. And hearing from everyone else, your talks, it was pretty amazing. And I hope if the Philippine government is watching also, of course, they will be able to learn to your sharing and discussion. So allow me to thank, of course, Dr. Sri Kumar for inviting me in this particular wonderful discussion. And hopefully I can give the inputs that I have with the Philippine scenario. So let me just share my screen.
Okay, so hopefully semua orang dah siap buat exercise tu. Tapi apalah nanti kalau saya boleh share lah jawapan ni. Sekarang jawapan tak ada dengan saya, nanti saya boleh share lah. Saya buat sini, saya share with you all. Okay, now I would like to move on to next. Okay, yang ni dia panggil trend index analysis. So trend index analysis ni, okay, so now we move on to trend index analysis. So trend index analysis ni is how we want to compare. Okay, just now kita compare antara year to year. Tapi ada satu masalah dia yang mana kita compare on historical. Historical ni maksud daripada contohnya 5 tahun. Tapi
I'm not really sure. Dr. Asif, you are anyway, so let me just share my slides to you, no? So I guess I'm introduced properly already, and to begin with the discussion, of course, I'm looking at safe tourism, the Philippines perspective. So I want all of you to wake up in the Philippines the next day possible, if ever you guys are going to visit our country. So the discussion flow will actually be going forwards with the efforts of the government, the efforts of the industry, and expected efforts coming from the tourists themselves. And finally, as I thought, I think it's political will, and I will discuss more on that as we actually move to the tail end of my presentation. So I'm happy to inform you, that for the past 7 days, we're practically having like a less than 1,000, which is actually a breakthrough, with our medical system with regard to how we actually combat the Philippine scenario with regard to, COVID cases. And so I think that's a starting point. We're very safe already with regard to our topic at hand, And with this particular case and scenario, and where we're actually looking forward for, a more progressive approach on how we can attack and address this kind of condition. But more importantly, which I think Dr. Rasif made mention also of their experience in Malaysia, it's more of we started with the safe tourism, with the advocacy campaign. If you happen to notice, this is practically the effort made by the Department of Tourism with regard to have a safe trip Pinas, And we are actually adhering to the World Health Organization, especially the World Travel and Tourism Council with the Safe Travel Stamp and the Philippines Department of Tourism. This is our way, of helping and adhering to the protocol made by the World Travel and Tourism Council. In fact, I was able to change my profile in the social media just to share to everyone, even my colleagues and my friends abroad, that we are, making our enormous effort to make safe tourism your travel and your travel here in the Philippines. Of course, we actually changed our COVID-19 alert system levels to make it more productive, to make it more collaborative, to make it more participative with regard to the industry and practically all the tourism stakeholders. So I think these are the efforts of the government in order for us to have, one language, one approach on how we can actually deal with a COVID-19 scenario. And having granted the safe travels by World Travel and Tourism Council, it gives us, a heads up, that we are telling the whole world that, hey, it's safe and good to travel in the Philippines. So these are, our efforts, in order for us to attest the whole world of our, sharing our practices and our best practices, no, with safe tourism. Let me share with you the thoughts of the government, particularly Secretary Romulo Puyat. No, we've made already the accreditation of establishments. So if you happen to check in every establishment, there's a check mark already, trying to attest the tourists, of course, that it is safe to dine in, to be accommodated in different hotels, and it's actually for free. The good thing about this pandemic is that they waive all the fees in the accreditation, but of course the same content and the quality will actually be in place. No, there's an issue to certificate of authority to operate. There is a collaboration with the Department of Trade and Industry and the Department of Tourism, particularly pertaining to tourism related establishments. And of course, with this particular attempt, no, we're actually convinced that there will be tourist confidence and satisfaction as long as they will actually see the accreditation and the seal. And of course, we would like to have a heads up also with the businesses, because we're actually particularly pertaining to the preparedness of the businesses. So it's an effort also on the side of the industry and the government. So it's a collaborative partnership between the two entities, not just to ensure diners and of course the guests that we are practically adhering to the basic safety protocols. The government is also very, very particular with the Department of Health. You know what? To my surprise, I'm actually teaching also risk management, no? And the collaboration now that's happening with the Department of Health and the Department of Tourism has been very, very influential in such a way that, we are very dependent on the Department of Health. So whatever is actually given by the Department of Health, of course, the rest of the agencies, government agencies, are practically, following the protocols. So imagine at this point in time, there's a big shift on how we actually look at safe tourism. It's DOH now is practically in the lead, and the Department of Tourism will actually follow. But before, medical know-how, it's just a matter of the basic requirements. But now it's the decision making made by the Department of Health has been tremendously affecting the decision making of practically the entire government. No, so they're advocating the implementation and full compliance of the protocols. Eligible companies assure guarantee that they conform to health and safety protocols required by the WTTC, and make sure that our stakeholders, communities, and workers, even workers, in the Philippines conform with the protocol. So you can imagine how the shift, on how the health department, or probably health minister in our Asian counterparts, are practically influencing our decision making already, particularly with safe tourism as an effort. Well, in the Philippines, we're talking about the mask, the hugas, the iwas, and the bakuna. So let me translate that into English, because this is a banner effort on how we actually consider safe tourism. So we have to put on the face mask, we have to clean our hands all the time, we have to protect ourselves, of course, like social distancing and physical distancing, and of course, be very vaccinated. So you're talking about a herd immunity. We're talking about this one as we actually look into the progress on how we actually, perform safe tourism for that purpose. And to tell you also some of the efforts, if you're looking at the other side of the other agencies of the government, we also have the Barangay Health Emergency Response System. So if you're looking at, even a particular tourist, a particular domestic tourist or a foreign tourist in the country, even the barangay, because barangay is a smallest unit system in the organization, in the political organization here in the Philippines, we're practically created the Barangay Health Emergency Response System, wherein the officers, the officials in the barangay will actually assist you on what will be the best thing to do. Because normally, if you are being contacted, of course, the thing is there's a panic. So at the smallest level, we're actually training, our Barangay Health Emergency Response System to address these kinds of concerns, And moreover, we have also the ESPAS. I think similarly to other countries that presented a while ago from my esteemed colleagues, we also have the Safe Sweep and Smart Passage, the travel management system, wherein there's a collaborative effort, especially with the local government. We're talking about our towns, our municipalities, and the cities in the countryside already. I was able to experience this one. So it's because I'm also traveling from one place to another, to inter-island this travel for that purpose. And of course, the effort of the local government. No, this is an example. No, similar to what I've heard about. What I've heard, a while ago with regard to the QC pass. No, we're talking about the QR code, the safe monitoring, health declaration, and mind you, even to my school, the Polytechnic University of the Philippines, on a daily basis, we are required to declare our health condition. So that will actually be being monitored as well. And of course, the intention is not for you to the intention is really for the university to help the employees already. So it's a common scenario here. So if you are a tourist in the Philippines, and if you are actually going to be confronted with this kinds of QR code, tracking form, etc., I think you don't have to be irritated. It's because it's a practice here in the Philippines. No, so well, if you are going here, then practically you are aware already what's going to happen upon, checking in a hotel or probably eating in a restaurant or approaching establishment. You will actually be brought into this kind of aspects already. And well, I think Dr. Zing was able to mention also that we're going back to the face shield policy to return once Omicron enters Philippines. Higher alert levels imposed. So definitely, this is a very recent news that we're going back. I think we're relaxing ourselves for like a week already for not using the face shield anymore. But with the recent news, the government is actually looking at putting it back again for protection. No, and what about on the part of the industry? Because we always believe that with safe tourism, everybody should actually participate. No, we're talking about, of course, the advisory made by the Hotel and Restaurant Association of the Philippines. So everybody is informed, and this is the biggest organization of professional hoteliers and restaurateurs in the Philippines, wherein everybody is like a member, even for their establishments, even for the restaurants. They are all members of HRAP, and we're talking about the entire country. No. And to their effort, even the organization is actually helping also everyone to be informed about, the safety and health protocols. So everybody is actually informed about this. And of course, with the advent of internationalization, especially with our international hotels, no, they created their own accreditation system. So if you're looking at Accor, we have Sofitel here in the Philippines. They have their own accreditation system, nor on top of the accreditation given by the Department of Tourism. So they have their own standards also, protocols also in their international practices. And of course, if you are a property of Accor, definitely the one that we have here in the Philippines is also being accredited. On the other side, if you've heard about Jollibee, one of the famous fast food chain, they were able to create even, a TV commercial on their own just to tell people how they are actually providing so much of safety protocols to their diners. No, so if you happen to consider these are some of their efforts just to guarantee the guests. No, and you'll be surprised, even the vaccinated ones will actually get a meal for free. So once you are vaccinated, you can actually get a meal for free. That's how we actually value vaccination here in the Philippines. No. Conscientiously, you will actually notice that in every restaurant, this is what I'm trying to tell you, that the DOT will actually have a safety seal. So just to guarantee also those who are going to approach a particular restaurant that, hey, we are all being accredited by the Department of Tourism. And even to our salon, no, just to tell everyone else, the employees are 100% vaccinated. And I'm very happy to inform you, our very famous Boracay, the Department of Tourism just recently announced that the tourism employees, the service providers, even the banquero, the one manning the boat, even the lifeguards are all 100% vaccinated. So these are some of the efforts. No, it's not only on the part of the government, but also in the industry, moreover to our employees, because we're talking about service industry for that purpose. And you will also be surprised that even our water transportation with regard to safe travels with To Go this 2021, they're practically providing also safety protocols. No, in fact, on top of what DOT is actually doing for everyone else. And even with our airlines, no, you're talking about the Philippine Airlines. So they're telling about travel worry-free with Philippine Airlines. But of course, no, with the alert level system, they have to adhere. So once the IATF, no, the Inter-Task Agency Force, declared of a different alert system, everybody is following. No? So those are the things that we're practically doing in the Philippines so that we can guarantee of a safe travel here. But of course, no, you're looking at different quarantine levels. You're talking about, the red countries, the yellow countries. The IATF made already several arrangements on how we can actually ease out. I think the red ones are banned for the meantime. The yellow ones, especially those kababayans, our fellow countrymen, if they're going here, of course, they are relaxing, of course, the quarantine, not just to allow themselves to stay more with their families. So these are areas of concern with regard to how we actually take into consideration safety, no? And mind you, even some travel agencies are providing already in their services travel medical kits, and it's a must for them. So I think it's a good move also on the part of the travel agency working in a travel agency. And of course, the PCR test subsidy application for qualified domestic tourists. So imagine the efforts also of the travel agency collaborated with the Department of Tourism with regard to subsidizing, no, the qualified domestic tourists when it comes to the PCR test. No, so imagine the efforts that we're actually giving the tourists just to ensure again safety. And these are all efforts which are very, very collaborative, no, integrated in that sense, no. Well, just to let you know, no, in the academe, since I am from the academe sector, so we're going to start already with our face-to-face. In fact, we started already, and there were some schools already, especially in the medical field, which started already ahead of the IATF resolution, because there's a go signal coming from the government that especially those skilled intensive courses or programs are already may actually apply for the grant of face-to-face classes. So there have been many hybrid cases and adjustments to be made. So if you're looking at the pictures, these are some of the efforts made by the academe also. And of course, there's a provision already with the Commission on Higher Education to allow everybody else to go into face-to-face classes already. But of course, we have to consider also the stakeholders, and primarily there have been consultations with the students and parents. So that's how we value also not the safety of our students and of course the parents, and moreover us faculty members, they're also looking into that. So if all forces or all stakeholders will actually agree, then it's a very successful face-to-face classes. Now, moving forward on how the expected efforts from the tourists, and this is what we're actually looking for. And I think one of my colleagues mentioned already, or how about on the part of the tourists? How are we supposed to guarantee safety? Imagine if you're looking at the government, if you're looking at the industry already, even the academe, if we are all in this particular battle. So what about the tourists? What are we going to expect from them? And we're hyping on this particular area. In fact, the role on shared responsibility has been highlighted by United Nations. And I think it was seconded already by Secretary Puyat. And let me reiterate on that. The concept of responsible traveling should no longer be limited to keeping our destinations and attractions clean and preserved. In the new normal, travelers will have a bigger role to play. The success of health and safety measures will rely also on their cooperation. So it's not only on the government, it's not only on the industry, it's not only in the academe, but we are to inform our tourists about their roles as well. Because if we are to do our role successfully and they're not going to participate, I don't think there will be a success rate of 100% on our intention. Now, how are we supposed to know that we have the shared responsibility? I think as simple as stay informed will actually be very, very useful already. You know what? I'm going to travel in a few months, in a few weeks' time. And even without somebody else talking to me, I'm conscientiously looking at what are the travel requirements that's going to happen to the local destination. So to me, no, as a traveler, I know what should be my role. And I have to be updated already. So similarly, I know that there is Omicron already. Things are practically doing over social media. So I think we have to emphasize also our role in social media, because most of the travelers now, especially in the profile of the Philippines, are practically millennials, Generation Z, because these people are really, having that kind of revenge tourism already. So those are the things that, will actually look into the aspect of shared responsibility. What else? We have to check on local travel requirements. So if you're looking at the flights, no, similar to what I mentioned a while ago, similar to Philippine Airlines, Cebu Pacific is actually sharing information. So if you're going to this particular local destination, these are the protocols, and they are updating you. And of course, I have to mention here, I'm going to travel to Tacloban. I'm also checking, no, every now and then, their Facebook post, their website, because it's a consensus effort on my part as a traveler. And I think we have to teach our tourists, no, in that particular sense also, to look into this kind of aspects. And I've been talking about personal consciousness. So if you are actually if you are doubting the wellness of your body, of your status, of even your mental and health condition, I think it's a personal consciousness that you have to make an effort, because you're not supposed to think about yourself. You're also to think about the people around you. And I think that's something that, that will encapsulate shared responsibility. Take our own efforts, because it should also start from us, because we are all travelers. And it's the basic rule for safe travel. Now, as I end my discussion, because of the limited time, of course, no, I always believe with the political will. I would like to quote, of course, Dr. Vicky Nair, no, telling about all the efforts of the government, all the efforts of the industry will actually end with the one powerful P. If you're talking about the people, the planet, and the one P that is the most powerful is the political will. I think it encompasses all. So we have to unlearn, no, from this particular perspective, that we have all been changing everything, and we have to unlearn from what we used to know, and try to embrace the new normal. And of course, not to our leaders, I think there's a clamor for adaptive leadership, something that will actually change even the conservation, crisis management, contingency plan, relearning, domestic tourism, flexibility development, because it encompasses adaptive learning. So I think if the government will actually be enforcing a more productive, a more progressive political will, things will actually happen so smoothly. So as I end my discussion, allow me to thank every one of you, and thank you for giving a chance for the Philippines to share our thoughts and our, safety measures when we talk about safe tourism. Again, in Tagalog, magandang hapon po. It's already 12:27 here in the Philippines. Magandang hapon po sa inyong lahat. Thank you.
Thank you, Mr. Jojo, for the very informative presentation on how Philippines is curbing safe tourism. And I think you brought up a very good point on the responsibility of the tourists. What are their responsibility and what they should do before they travel into another country. This is something that is very interesting. So, ladies and gentlemen, we are open to questions. If there's any questions from the participants, the speakers are ready to take the questions. Any questions? So, if there's no questions, we come to the end of our event today, and we take this opportunity to thank Professor Dato Ansari to be our VIP, and also the speakers from the Philippines, Indonesia, China, and not forgetting our speakers from New York and our speakers from Malaysia. iPortal and DHS, we will be having an event on the 7th of December in Kedah and Penang in Malaysia, 9th of December in Kelantan and Terengganu, and 10th of December in Johor, Malacca and Seremban. So we hope to see you all again here. And thank you very much, and have a pleasant afternoon and stay safe. Thank you.